Good evening, friends. I am Dr. S Mhadeshwar from Kankoli. Today I am going to discuss about preservation of beta cell function, especially in diabetes mellitus patient. There are many patients where the beta cell function is deranged. Many times beta cell function is already less by 50% in most of the diabetic patients. And there are some patients where the beta cell secrete excess insulin also. Because today we will discuss only about the deficiency of insulin and diabetes mellitus. Now when we diagnose somebody has got diabetes mellitus, the beta cell function may be less than 40 to 50%, and we have to preserve this beta cell. So many times we give some medicine to secrete more insulin by this less number of beta cells. It is possible to increase insulin secretion, but it will be at the cost of death of the beta cell. Normally, every year 4% beta cell they die in a diabetic patient. At the same time, 0.6% beta cell they die in a non-diabetic patient also. So this is called as apoptosis. And what is apoptosis? Apoptosis is death of beta cell without producing any toxins. So when the beta cell they are less, maybe 40 to 50%, many times some people, this healthcare provider, they give high doses of some secretagogues, especially sulfonylurea, and they try to increase the insulin secretion. Because this is not advisable, because as the age advances of a diabetic patient, number of beta cells will be definitely less, and for less beta cell, stimulating with high doses of any secretagogue is not advisable. So the best treatment in the management of diabetes will be lifestyle modification, and as far as possible less dose of secretagogue, and at the same time we have to stimulate this beta cell by giving adequate dose of gliptins, DPP4 inhibitors, and the action of DPP4 inhibitor is always glucose dependent. So when the glucose level comes to normal, there is no excess stimulation of this beta cell to secrete more insulin. But with the sulfonylurea, those are not glucose dependent. There is excess stimulation, and sometimes patient might get hypoglycemia also, or sometimes because of high doses of these secretagogues, especially sulfonylurea, the beta cell damage can be there, and over a period of time, number of beta cells they are less, and instead of increasing the dose of sulfonylurea, sometimes there can be hyperglycemia also, and then people they treat with insulin sometimes. So it is better to give an adequate proper dose of all these secretagogue. There are some patients, those are diabetes with a severe deficiency of insulin, and initially these patients they come with the typical symptoms of diabetes mellitus, polyphagia, polydipsia, polyuria, and weight loss with a high level of glucose. And it is called as glucotoxicity. Fasting may be more than 250, and postprandial can be more than 350. And this is called as glucotoxicity. And there is something called as lipotoxicity also. So only because of high glucose level and high lipid level, there is a death of beta cells. So this is called as glucolipotoxicity. For such patient, if you want to preserve whatever amount of beta cells they are there, we have to give insulin also, maybe for a very short period, and later on we can give oral anti-diabetic regimen as per the requirement of the patient. So ultimately, preservation of beta cell is more important, because patient should not land up with the insulin therapy in his old age. Initially, if the blood sugar is very high, treat it properly with adequate dose of insulin, so that exhaustion of beta cell can be prevented, and later on the death of beta cell will be also less. So this is more important in the management of diabetes, and this is called as beta cell preservation. There are many other elements or minerals or trace elements or vitamins which are equally important. For example, vitamin D is vitamin which is required for the beta cell function to improve its function. Thank you.